the whole presentation today. And that recording has started. So today we are talking about bridging coverage and care, health insurance navigation for people who use drugs. And today our wonderful speaker is Carter Crooks, who is a case manager for A Better Way, where he develops and oversees programs that improve access to healthcare, address food insecurity, and support individuals on their recovery journey. Carter is also a graduate of the University of Memphis, and a certified peer recovery specialist and a certified application counselor. He leads A Better Way's SNAP enrollment and health insurance navigation programs and created a participant volunteer program that helps individuals build responsibility, confidence, and self-worth through meaningful community service. His work focuses on reducing barriers to care and connecting people with resources needed to achieve long-term health and stability. So please give Carter a great welcome. And Carter, I'm going to pass it off to you. Thank you for being here today.
All right. Thank you for having me. Thank you for the kind, wonderful introduction. The title of this session is Bridging Coverage and Care, Health Insurance Navigation for People Who Use Drugs. And we'll go on to the session description. So this session will aim to explore health insurance navigation as a strategy to improve access to care for people who use drugs, including steps to becoming a certified navigator, also called a certified application counselor, best practices for supporting enrollment, lessons learned from implementation, and approaches for addressing common barriers to coverage and care. All right, learning objectives for the session. Number 1, describe the role of a health insurance navigator in supporting people who use drugs and the steps involved in becoming a certified navigator. 2, identify best practices and lessons learned for supporting health insurance enrollment and access to care among people who use drugs. And 3, apply health insurance navigation strategies to real-world scenarios involving common enrollment barriers and participant needs. Okay, so I guess we'll just start off by kind of going over what a certified application counselor or a navigator actually is. So a certified application counselor, or a CAC, is an individual trained and certified to help people understand, apply for, and maintain health insurance coverage through federally facilitated marketplaces. These are marketplaces such as Medicaid, CHIP, which is a child health care insurance program, and the health insurance marketplace through healthcare.gov, which was established by the Affordable Care Act. CACs are authorized through organizations that have been designated by the federal government or state marketplace programs to provide enrollment assistance. Okay, so just in order to give you guys a better picture of what a CAC is, I'll go through some of the things we can and cannot do. So a certified application counselor can explain health insurance options, help complete marketplace applications, help complete Medicaid and CHIP applications, help determine eligibility for financial assistance. Big one here, explain premiums, deductibles, copays, and other insurance terms. A lot of times the people that we're working with don't have any idea about what these things are. We provide unbiased information about available plans, assist with coverage renewals and updates, and help resolve enrollment issues. Okay, now some of the things a certified application counselor cannot do. We cannot recommend one insurance plan over another based on any form of compensation. We don't tell consumers which plan is best for them. I tend to stay away from giving advice in general. Rather, I find it's better just to present all the options available and allow the consumer to make their own informed decision. We don't receive commissions from insurance companies, cannot act as an insurance agent or broker unless separately licensed as such. We don't make any kind of eligibility determinations for Medicaid or marketplace programs. All right, now let's take a look at why certified application counselors are important for people who use drugs. For many people who use drugs, obtaining health insurance coverage can be the difference from relying solely on emergency care, stacking up a mountain of medical debt, and accessing ongoing and preventive healthcare services. Certified application counselors, we help reduce barriers to primary and preventive care, substance use and mental health treatment services. That's a big one for us. And prescription medications. In community-based organizations, such as A Better Way, a certified application counselor often serves as a trusted bridge between participants and healthcare systems that may otherwise feel difficult to navigate. Being a certified application counselor is not just about completing applications, it's about helping individuals overcome barriers to healthcare access and supporting them in using their coverage to improve their health outcomes. Okay. Now that we've kind of gone over what a certified application counselor or health insurance navigator is, we can kind of talk about the steps you go about to becoming one. These are basically the general steps to becoming a certified application counselor. Number one is to work or volunteer through a designated CAC organization. Two is complete federally required training through the CMS, which is Centers for Medicare and Medicaid Services. If I remember correctly, the training takes about 3 to 5 days. It's very in-depth and thorough training. I probably stacked up like half of a notebook full of notes because there's a lot of information there. And then number three is to pass the certification assessment at the end of the training. Four, sign required privacy and security agreements. This is mostly because you're dealing with a lot of personal information and there's a lot of policies and rules you have to adhere to. Number five, complete annual recertification training. Okay, so we come to our first interactive segment, just to kind of get people talking or thinking about it. So I would love any kind of interaction here. What barriers do you guys encounter most often when helping clients who use drugs?
I run
And for
into
the
a lot of people who don't have a primary care provider, even if they have insurance. So getting them treatment for anything they test positive for is difficult.
Yes, it is. And then here on the Minty, like the second kind of part of that was what barriers do you encounter most often when helping clients access healthcare as well? Okay, I see people mention lack of IDs, negative past experiences, affordability, always having no insurance is the hardest part. They do not understand the insurance plan itself, the stigma of going to the doctor. I see stigma again. That's one that we encounter all the time. The not trusting of doctors. It's hard to get them to even want to do it. Finding a primary care provider, prescriber who can treat quickly and without stigma. That's always something that we're looking at, is finding ways to have a primary care provider on site. Not trusting physicians or care providers. Well, that's a lot of feedback. Thank you
Yeah,
guys.
we also have some in the chat too, not knowing if they have insurance. Some folks get signed up but don't realize that
Yeah.
they have it.
Yep, these are all really great answers.
I think this just shows that there are a lot of barriers that people experience trying to access healthcare.
Yeah, there's a lot of barriers. This is true. Whenever we finish with this section, I'll talk about some of the most common challenges that I encounter uh, helping people access healthcare.
Yeah. So next slide.
Okay. So a lot of people mention some of these. They're pretty very common challenges. So no ID, that's always a big one. No phone or email access. Um, a lot of a lot of our participants, people who are in later stages of substance use disorder, don't have phones or email access. A lot of times, the people I'm working with don't have transportation. This is probably competing priorities. I bolded because I feel like that's is probably the biggest challenge. Is just the competing priority with drugs, because there's constantly withdrawal or the fear of withdrawal with people who use drugs. Being a person who used drugs myself in the past, like it's like you're always on the clock. Just even finding an hour or two to make an appointment, um, you feel like you're gonna be set back on on your uh, maintaining your drug habit, so much so that you don't want to do anything outside of just making sure that you have enough of the substance to continue. Failure to keep appointments. I run into this all the time. Despite, like, we did take efforts to reduce barriers, like having an office that's walking distance from the largest portion of our participants. Mistrust of healthcare systems. I saw this a lot in the feedback. um, I know a lot of our people report all the time negative experiences with healthcare systems, that they're treated like not even like a human being, like no respect. As soon as like a healthcare official finds out that somebody, or even suspects that somebody uses drugs, the whole kind of demeanor changes. And we've had people sit in waiting rooms or even the hallway, not even in a room for like 24-hour periods. And when somebody is in substance use disorder, like they just can't wait that long if they're, if the substance use disorder is not being addressed at the same time as, whatever they're going to the hospital or doctor for. Previous loss of coverages, change in laws. So another big thing that I do here at A Better Way as case manager, besides the insurance, is a SNAP assistance program. The big beautiful bill just changed the laws around the SNAP program so that homelessness is no longer an exemption. So all the people, who were getting benefits just for being unhoused or homeless can no longer get that. Now there's a requirement that you have to be working 20 hours a week or volunteering 20 hours a week. And then a lack of work or tax history. This is like a really big one when it comes to um, marketplace insurance plans because they pull their eligibility basically based off of your tax history. Um, but anyways, these barriers are very real and they make it extremely difficult for enrollment in certain programs. Like I said, especially the marketplace plans. So other programs like SNAP and Medicaid in some instances are a lot easier to achieve for our participants. And we'll go on to the next slide.
Before that, Carter, we
Yeah.
have a few things going on in the chat that I think could be really
Yeah.
useful to talk about. But we have someone mention, Frankie, and if you want to expand at all, feel free. Never having had health insurance to having health insurance is scary. As you know, some of those challenges, and health insurance potentially means disclosing personal information to providers that may have not ever been spoken on. And so just that there's like these additional things that may not seem scary to some of us, but really scary to others when accessing health insurance. Is that something that you've also seen, Carter?
Yeah, it is. And so that's like going kind of like leads into my next segment of lessons that I've learned is that trust comes before enrollment. So I mean, participants rarely, disclose all their needs during a first interaction. Relationship building almost always precedes successful enrollment. So just taking the time, and kind of our intake process at A Better Way facilitates a lot of motivational interviewing and having like an honest, like non-judgmental conversation where you get chance to kind of build rapport and trust with someone. And meeting people where they are, although it is very cliche in this industry, it still remains true. And this is kind of like how we do it. Um, we do offer enrollment assistance during outreach and syringe service program services, specifically for if somebody's looking or in a situation where TennCare Medicaid would be better for them, as well as like SNAP enrollment. Those are both like relative, they're a lot lower barrier applications, that can be done kind of on the spot and don't require, like an hour or more block of time to do. Um, Also, like flexible scheduling. A lot of people, like we said, aren't going to make appointments. So just kind of being flexible with when people can come in and work on stuff on applications and follow-ups helps a lot. Low barrier engagement. I mentioned that our office is like in walking distance from like our outreach site, where a lot of people actually live, in tents nearby in the area. Um, and do not get discouraged by setbacks because they're going to happen all the time. And number 3 lessons I've learned in the field is that documentation is everything. Um, If you don't document it, it basically didn't happen. And it really helps. It helps me a lot because I've got an extremely large caseload, and managing that after developing a few like spreadsheets and a little filing system, it's a lot more manageable because it's a lot. I mean, when you have hundreds of people, that you're seeing, on a monthly basis, it's hard to keep up with everything. Okay, we can move on to the next discussion section. So yeah, I just wanted to ask you guys, what are some of the major things that you all have learned from working with people who use drugs, and also what are the greatest challenges you encounter also working with people who use drugs? Give you guys time to respond to that.
We have some questions in the chat that we'll pose now, and that while people are responding to this question, how do you help people get identification, or is that a service you offer? Seems like that would be needed to do any of the steps to get enrolled or to get into care.
Okay. Well, so for at our organization, a lot of times we have, it comes with community partnerships. A hospitality hub is a great resource here in Memphis that we kind of like rely on a lot. They basically, pay for the entire process, like of getting an ID. They send the person with a voucher, the courthouse, wherever they get the ID, the DMV is like walking distance from the hospitality hub. I like personally have, helped people with other documents like social security cards. Somebody can come in and we can sit down at the computer, and that's just like a matter of just ordering it online. Um, I know I've helped people get birth certificates. And that's basically just, driving to the driving to the health department, and but that's basically what we do for helping people obtain like identification documents.
That's great. And kind of on that point of in IDs, someone is asking if you know if there's a way to bill health insurance for IDs similar to like how you can do that for transportation reimbursement.
Um, I don't know. I'm sure there might be, but I haven't made it that far yet.
Yeah, I haven't heard of that
I'd
either.
love to find out.
Yeah, I haven't heard of that yet either. I'm not sure that you can build health insurance for IDs, but I don't know if there's somebody else on the call that knows an answer if they've tried that before. Okay, so you have some responses. We have some responses in the Mentee. Treating them with respect goes a long way, and from personal experience, having someone to see past the addiction helps tremendously. Not having enough resources in the community, or not having a working knowledge of them at least.
Yeah. Yeah, these really are things that we see a lot. I know like networking, just getting to as many kind of like community events as possible and meeting, people from that work in other organizations in your community, is critical, especially for that second one, not having the resources. Because a lot of times the resources are there, you just don't know about them. And, just kind of trying to get out at networking events, community health fairs, really helps kind of building out your referral network.
Yeah, that's a really great point about that kind of additional efforts that are made to make those connections and find out what's, in the community? Because sometimes there are resources that just so not well known, or they're newer, and being out in community to make those connections are so important.
Yeah, also see it. It's important to be patient. We're all just doing our best. That is it is important because sometimes, a lot of times, these processes can take, longer than I like, definitely longer than, the participant likes. And just also being patient with the participant. Just, like when somebody's, in substance use disorder, especially like the later stages, it's kind of like it's harder for them to understand that, like that I'm not the one who's making the eligibility determination, like so they come to me and I'm kind of helping them with their case. A lot of times people, can ask me like, why haven't I been approved, or all these questions, or when am I going to get my card? And, you just have to be patient with people and kind of try to help them understand that, I'm just here to assist. I don't make the eligibility determinations, and just kind of give them like a time frame, of how long it's going to take.
Yeah, that's great. Like really having to check our egos at the door of like people have really frustrating experiences and you're the person in front of them. So
Yeah.
they might, you know, talk about it with you or vent with you about it, but it can feel sometimes like an attack, but it's not. It's just people having a hard time, and
Yeah.
being that support and being like, yeah, this does suck, can really make a difference for a lot of people.
hmm And it can be like discouraging. Like you'll think that everything's like going smooth, they're about to get approved, and then all of a sudden, you get a letter that somebody needs another verification, about maybe like a job or like a line of, income that they had, multiple years ago. And, that's when it's almost impossible for them, to kind of get that verification. So that's when we kind of, step in and guide them, about how to get it.
Awesome. We also have be transparent with what you're doing. It's a complicated process, and all the things involved can make people wary. And I guess, like, can you talk to that, Carter, of like how do you balance that transparency without maybe like scaring people away too, that it is going to be, a pretty complicated process?
Well, yeah, just basically kind of explaining like the whole process on the front end, what's going to be involved, what they're going to need, and if they like, if someone doesn't think that they're going to be able to, like meet all these requirements, we might go another route. So like us, like for example, doing like a marketplace application, somebody has to have W-2s, work history, ID. They need to have like a working cell phone, just to even log in. You have to have like your own cell phone number, to be able to log into like login.gov or ID.me. So a lot of times, like that narrows down, the options that we're able to do at that time. So we just kind of, tell them step by step what the process is going to be, if it's something that you still want to do, and, we kind of accommodate the best that we can.
Yeah, and then we also had someone just chime in with preparing them for what to expect in the process. Like if there's a chance an appointment they have to go to might treat them some type of way or be super formal so they know what they're walking into. So kind of giving them a heads up what their appointment might look like.
Yeah.
Next slide, Ali. Yeah, perfect.
Okay. So now just kind of talk about, just kind of like a case study. This is I've changed the person's name. But so we'll be talking about Alice. So just so you can kind of see what this looks like in practice. So Alice's introduction. Alice came to a better way. Um, she came with a friend who was a more regular SSP client. Um, and then Alice proceeds through our intake process. And this is kind of what we learn about Alice and her situation through that intake process and conversation we had is that Allison's 19 years old. She reports being homeless. Sometimes like hotel hopping. Sometimes she has money for a hotel, sometimes not. She's pregnant and has not been to a doctor since learning she was pregnant. She has no insurance. She self-reports that she smokes weed. The boyfriend or father of the child is on fentanyl and methamphetamine, occasionally is abusive and forces her to perform sex work. The mother, Alice's mother, has severe mental health issues, also a drug habit, and has just kicked Alice out of her hotel room where Alice was staying. And there's no father in the picture, and the grandfather, who was her primary caretaker, had recently passed away. So Alice is is really in a situation and basically just reaching out for help. She doesn't know where to turn. And next slide. So yeah, I just wanted to I'll kind of like laid out the situation. I'm curious before I, kind of tell you how I proceeded with Alice. Just kind of where would you guys begin with Alice? What would your number one priority be?
You can use the Menti, or if you want to come off mute, you can also come off mute and talk about, you know, where you would begin with Alice or what might be your first priority with Alice. You can also use the chat. So I would ask Alice what her topic priority or more immediate need is, and then go from there. Definitely try to get her on 10 care. Carter, feel free to jump in at all on any of
Okay.
these too. Yeah.
Normally prioritize eating a snack with someone, especially if it seems like they haven't eaten. Yep, that's always a great way. Food's a great way to bond and build trust. Um, it began with acute needs, food, clothing, hygiene, prenatal. Someone else says I would try to get her into housing first and then with medical care. I would ask her goals and immediate needs. Give you guys just a little bit more time if anybody else wants to answer. Okay. Well, we can go on to the next slide. So this is basically how I proceeded with Alice. We had like a long conversation. This is where we learned about Alice's situation. Um, Using motivational interviewing, which was initiated by our intake protocol. So I just wanted to like highlight that, things that your organization has in place, like can really help with that process of kind of like spurring honest conversation. Worked on building trust and rapport. uh, with Alice, and then conducted just like a brief on the spot needs assessment. Um, and then we proceeded by doing a SNAP application because that is really easy to do. It takes like maybe 15 minutes just to do the application, maybe like even five sometimes. But so then I saw somebody else do this, get her on 10 care. Yep. So 10 care application, uh, which like for people who are pregnant, it's like an automatic qualifier. So like there are situations where 10 care is like fantastic and super easy to use in certain situations if you know that somebody meets like one of the qualifiers for that program. And so for Alice's case, she did. Um, and then we had follow-up appointments at our office with flexible scheduling to set up her 10 care connect online accounts, and then just other online accounts like you get three choices of providers when you with 10 care Medicaid. I think it's WellPoint, United Healthcare, and Blue Care. Um, and so like she basically just needed to come by and we helped her with setting up all her online accounts. Um, and then, once she has that Blue Care account, she can select, see what primary cares are in her network and OBGYNs and we were able to get her appointments with both. And so like Alice's case was a little bit easier because the Alice only reported smoking weed. It is like more challenging with people who are, further along in substance use disorder, especially with like harder drugs like fentanyl and stuff, just because it's hard to make appointments when you're always on the clock. Um, but then we basically provided clothes, hygiene supplies, which also helped with building trust. We leaned on the community partners, a hospitality hub again here. They have a program called Hub Hotel, which is like specifically for like pregnant women and women like who have recently like had a child. So that's like a housing situation. So we are able to get her away like from the like abusive uh, child's father, and just out of that bad situation. um, and then like we did have to like help her with transportation to appointments. She didn't have any kind of transportation. We kind of banded together on that. Uh, because like so many people don't take advantage of it. Like we're able when somebody actually is like willing to like make appointments, like we do have like muster up enough manpower to help them with transportation for that. I don't know if we'd be able to do that if everybody utilized that, but since they don't, we're able to kind of help with that. And then just continued communication and following up with Alice. Next.
I think we're gonna skip the final discussion just because we're getting
Okay.
at time and get to your last couple of slides and then open up for questions after.
Okay. So yeah, I just made a conclusion page. Just working with people who use drugs is very fulfilling work. Nothing, it feels so great when you do get somebody or help get somebody enrolled in insurance or a SNAP program or any kind of program that's going to like really change their lives in a meaningful way, and open up all kind of like options for them, to improve their health. There are many challenges which require creative solutions. I love problem solving and being able to find creative approaches. Building a robust referral network through networking is critical. Without that, we wouldn't have had, referrals to like the hospitality hub for housing. I put lean on your community partners. Don't get discouraged when things don't go as you hoped, because they rarely go exactly like you want them to. When things finally click for somebody, there really is no greater feeling, or success. Relationships improve enrollment success. Navigation continues after coverage begins. I think Alice was a good example of that. We worked with her, because once coverage begins, they still have to, make appointments, select a primary care, and a lot of people need help with that. So yeah, thank you everybody for your time and the participation. Any questions?
Thank you so much, Carter. Please give a round of applause for Carter. We appreciate you being here and really sharing your experience. So if there's any questions for Carter and anything someone wants to bring up that we've talked about today, please feel free to. You can come off mute, use the chat, or use the Menti. I have a quick question for you, Carter, as people
Okay.
are maybe bringing in their questions.
Yes.
How was the training? Like, was there anything that was unexpected or any advice you would give around getting set up with the training?
The training was like a lot harder than I thought it was gonna be. So it was like I felt like I was back in college again. Like taking like all kind of notes, just because there's a lot of considerations, especially like surrounding the privacy policies, about people, about, personal information. And then um, there's like certain like ethnic groups that have like special considerations and like whole different sets of like guidelines and rules. For example, like Native American populations. There's like a lot to learn and consider. But it wasn't anything that, if you take notes and study, then anybody could do it.
Was there a cost for this certification? Is a question in the chat.
No, as far as I know, there was not a cost for it, but I am not 100% on that. Lisa, our director, would have to answer that question.
We can also look into that and follow up with
Yeah.
everybody on the call too.
Okay.
Was it a self-paced training or is there like how long was the training?
So yeah, so it actually was a self-paced training, but just because of when we signed up, like there was um like an enrollment period, where so there was like a deadline, and I guess we kind of like got started late. So like for us, we like did have like I think like a week to complete it. But if you had started like before that, before we did, it was basically self-paced. So you could, work on it like 2 or 3 hours a day, so it wouldn't just like take up your entire day.
We also have a question in the chat. You say you have a huge caseload. Any suggestions for how to implement this service in an SSP setting?
Yeah, so I mean, I work in an SSP setting. How to implement this. So when you say this service, are you talking about insurance navigation specifically, I assume?
Yes, and how, like, if we didn't have um maybe somebody who could do solely that role, how outreach workers might be able to
Oh,
navigate doing it.
Okay. Oh, yeah. So, well, I was talking with Rebecca before the session. So with certain programs like TennCare, Medicaid, uh, you don't, I believe, even have to be like a certified application counselor for that specific program, as long as the person allows you to be their assisting person, I think it's called, which is basically an authorized representative. Um, you can just kind of go through the application with them. There's at the beginning of the application, there's a section where, they select you to be their assisting person, and you just kind of go through. So I had one here with me, but the TennCare application is about like 15 pages, and it takes about 20, probably like 30 minutes to complete with somebody. So, if you can have like enough staff that you can break away and spend like 30 minutes with like a specific client or participant, you can do that.
Thank you.
Yep.
And it sounds like, being able to go through that training just to have a better understanding and knowledge of the process could be helpful when even just giving maybe some tips or suggestions to, SSP participants for them to get themselves started to better understand what that process is.
Yeah.
There's also a question, anything you wish you knew before becoming a CAC or counselor that would have helped you better begin that role?
Let's see. What did I wish I knew before? Um, I can't think of anything that like specifically that I wish I knew before becoming one. What I wish is that, more people would just I wish that the barriers were lower so that I could, or that more people would actually take advantage of like this service that we're offering. Um, and that's just like a challenge that we're always trying to, figure out the solution for, is how to get people to engage, and take advantage of like the services that are there for them.
And if anyone, to the previous question too, that's like interested in maybe having something similar or talking through kind of your experience, is that something like they can connect with you on?
Yeah, that's fine.
Okay. So we'll make sure to get your contact in the chat too.
Okay. Yeah, that's fine.
Uh,
Anybody reaching out?
well, please we'll end the recording here. We got 4 minutes, so we're gonna wrap up here today. Thank you all for joining and